Okay, so there's going to be multiple videos. I forgot that there's a 10-minute time limit on these, so I'll just upload them as we go. So C-reactive protein. C-reactive protein is what happens when your body has an inflammation. So your body has inflammation somewhere. The C-reactive protein gets released, and it's in your blood essentially. But so C-reactive protein says, hey, there's inflammation. And the higher the CRP level, the more inflammation in your body. But there's a downside. So CRP is not specific. You could have increased CRP levels with cancer. You can have increased CR levels with coronary heart disease. You can have, pretty much if you have an infection, you're going to have infection as well. Any type of misalignment in your body, you're going to have increased CRP levels. So CRP is very good at saying, okay, yeah, there's inflammation. It's here. You can reach a diagnosis or a possibility of a diagnosis of rheumatoid arthritis with a CRP test. It's really going to be great in monitoring those flare-ups because, if you're having a flare-up, they're going to look at your blood panel and look for those CRP levels. So inflammation in your body increases the level of C-reactive protein, and it can indicate an infection or other condition, just like rheumatoid arthritis, because rheumatoid arthritis is going to be that immunoskeletal disease. So it's looking at both versus just one system. Okay, so just like we can test for calcium in the blood, we can also test for phosphorus. Phosphorus is essential to bone growth because it works with with calcium to build strong bones and strong teeth. And phosphorus in the body is an electrically charged particle called phosphate. And that phosphate in our blood is a good indicator that we have things like osteoporosis or we're healing from a fracture going on. And I really like this. It's pretty simple. It's performed to check levels of phosphorus in the blood. Increased levels can indicate osteoporosis and fracture healing. Okay, so we've already talked about gout, and uric acid blood test is going to really be a good way to test for gout. This is going to check the levels of uric acid in our blood. We are going to have uric acid in our blood most of the time, but when it's increased, that can indicate that we have gout, we have some arthritis, multiple myeloma, and rheumatism. I really want you to associate uric acid with gout, not necessarily the other ones just yet, just really focus on gout. So I love this picture. So here we can see the normal red blood cells, and we can see normal red blood cells here. But in this picture, the stuff that looks like salt, that's uric acid. Uric acid will actually clump up in the blood, and this is what gets in those joint spaces to really produce that inflammation response, which causes the swelling and the pain. It's when we have the uric acid in between our different joint spaces. Okay, so this is pretty interesting. So on this one, if you're following along on the notes, so the question or the in the middle column, it says abnormal ALP levels can indicate blank problems as well as bone issues. So that word that's going to go there is liver. So alkaline phosphatase typically gets filtered out by our liver. When a doctor orders a blood panel, they look for, and they typically check your liver. So they're looking for very specific things. ALP is one of them. They're also looking at, I think it's called AST and ALT. But all three of these are good indicators of the efficiency and the health of the liver, because if they exist in normal conditions, then that means that the liver's filtering them properly, therefore the liver is functioning. But if we have an increase in our ALP, ALT, AST, that means that our liver is not doing a good job, right? So our liver is unhealthy at this point. We can have different symptoms going on. So if all three are elevated, that means that we have a liver issue. However, if your other two levels are normal, but your ALP is elevated and you do have other symptoms, this is a very, very good indicator that you have a bone disorder. So ALP is what happens. ALP is produced when bones are growing. So if you have any type of bone tumor, rickets, osteomyelitis, so in fracture healing, this is where bone is going to grow too. ALP is a very good indicator that our bones are growing. Um, so Paget's disease, we'll see this ratio increase. So this 10 to 25 increase of ALP, this is always going to be a norm with Paget's. I do want to point out physiologic bone growth. I'm trying not to. So right here, physiologic bone growth. This is just normal bone growth in your body, right? So a 13-year-old, 12, 13, a young child who's still growing, they're going to have those increased levels of ALP. That's normal. Hey, hold on just a second. Let me stop this.